Are you intimidated by the idea of therapy? Are you worried about the cost? Are you overwhelmed by the healthcare system? Maybe you can't get an appointment for months, or maybe you just don't believe in therapy. In this video, we're exploring why therapy isn't necessarily the magic solution that many people think it is. I'm not here to criticize therapy. Actually, I really believe in it. And I have been fortunate enough to have a couple of great therapists in my life. But I want to talk today about the reason why it might not be for you, your friend, or your loved one. And I'm here to encourage you, your friend, or your loved one to start healing, even if that doesn't include therapy. And stick around to the end of the video because I'm going to share with you some resources that might either get you started or help you continue on your healing journey. Hi, I'm Kristen, and welcome to my channel. I'm passionate about mental health. I have a degree in psychology. I got the degree because it really fascinates me. I'm a registered nurse and a nurse educator, but more importantly, I have healed from the majority of my past traumas. I used to suffer greatly with anxiety, depression, and PTSD, and this really impacted my day-to-day life. I had chronic emotional and physical pain, and my relationships suffered. I was triggered often, not knowing why. While I'm not perfect, I rarely suffer on a day-to-day basis. I enjoy my life so much, and I want to share my knowledge so that you can heal too. It is possible to suffer less and lead a happier and healthier life. I want to give you permission and encouragement to start healing without therapy. If all of this sounds good to you, click the subscribe button down below and hit the thumbs up. So let's talk about the reasons why therapy might not be for you. I live in the United States, and as I said earlier, I'm not here to criticize therapy, but I am going to criticize the insurance industry in the United States. So this section, if you're from a different country, just know that this section will focus on insurance in the United States. Most private insurance plans will not cover mental health services until you've reached your deductible. And average deductibles in the United States can range from $1,500 to $3,000 and sometimes more. So that means that you'll have to pay full price for your therapy visits until you reach that deductible. Once the deductible is met, most companies will charge 80 or 20, they'll have an 80% coverage and you'll have to pay 20%. So in my example, I was paying $147 per visit for therapy until I met that deductible. And after that, you still have to pay, but my visits were then only $29 per visit once the deductible was met. So for public insurance, and this would be Medicare, Medicaid, any of the state-funded programs like that came about through the Affordable Care Act or Obamacare, they often have better coverage, so you won't have to pay as much out of pocket. However, the reimbursement rates for the therapist or the providers is less, so it's harder to find a therapist that will actually take these plans. You can't just see any therapist. You need to see a therapist that your insurance company covers. So what you can do is you take your insurance card and flip it over. On the back side, there will be a 1-800 number. Sometimes it'll be a local number, and oftentimes it'll say behavioral health. So call that number and they will give you a list of therapists that are covered in your area. So they can either email it to you, sometimes they can text it to you, and I'm sure that they're also willing to send it to you via snail mail. The therapists on the list might not be able to take on more patients. I have 2 teenage daughters, both that are in therapy, and I called the insurance company, got the list, and then you have to sit down and make phone calls and emails, reach out to the therapist to see if they can take on new patients. And what you'll often hear is that they can't. They don't have any room to take on new patients. And so this can be incredibly stressful when you're already in the middle of a stressful situation. So let's say you found a therapist, you actually successfully found one that then has openings, and you schedule an appointment and they end up not being a good fit. So I had one of my daughters, I just recently I'm still in the middle of paying off a $400 bill for a therapist that my daughter ended up not liking. She went to see her 4 times, and then after 4 times, it was just like, this isn't jiving. It's just not a good fit for me. So it can really be an incredibly expensive thing to have to kind of feel out a therapist and see if they're going to work for you. Not all therapists are good. Have you ever heard that statement, what do you call a medical student that graduates last in their class? And the answer is doctor. Well, the same applies for therapists. They're just human beings, and some are better than others. There's a stigma related to therapy. Many people don't want to go to therapy because they just don't think that their situation is bad enough to justify it. Also, many people think of therapy as a sign of weakness, and so that really prevents some people from even considering it. There are cultural ideas about therapy. Some cultural attitudes make people unwilling to seek mental health care services. In the United States, there is a feeling of distrust related to discrimination in our healthcare system, and that can make people resistant to seeking help. Therapy is not a magic bullet. So let's say you find the therapist, you got the list from the insurance company, you made the phone calls, you found one that would had an appointment for you, you went to the appointment, you got along, you like the therapist. You still have to practice the skills that the therapist gives you. It's not just an automatic thing. You go to therapy and you're going to be better. You have to do the work. So I was lucky, like I said at the beginning of the video, to have a couple of really great therapists. But they were guides. They guided me to some information that was really useful, and I had to practice the skills to get better. So if therapy isn't the right answer for you, what do you do? I've created a free resource list. You can click down below. There's a link in the show notes called resource list. If you click on that, I will send it to you. And it includes some of the practices that I have used to heal myself. These are tried and true things. They are things that I know that work. And additionally, I've also included some information about how to navigate the insurance system to kind of get the most out of your insurance if you are interested in seeking therapy. Thanks for watching this video. Thanks for making it to the end of the video. If you know someone that you think would benefit from this information, please forward it to them. And it would be great if you gave me a thumbs up. That'll help ensure that other people get to see it. And click the subscribe button if you want to be notified about new videos. Please, if you have any ideas about what you'd like for me to cover or want more information about or just something that you want to share, please leave me a comment down below. Thank you so much.